So today, yes, we're going to be talking about older person's physical health prompt. I'm never too old to be asked physical and mental well-being. So Neami, and again, just an acknowledgement to country. So we delivered a presentation to New South Wales Health around the service, as part of the service improvement project. So it was a statewide physical health project for older persons living with a mental illness. And physical health and social isolation have been identified by older people as two of the important areas of well-being that require intervention and to improve the quality of life. There can be confusion around who is actually responsible for assessing and monitoring the physical health of older persons accessing mental health services. And we had a great segue coming into this earlier on. Work conducted by Neami, our health and wellbeing team, in addressing the physical health of individuals living with a mental illness has gained interest across, New South Wales, but also across the mental health sector. And this resulted in us being requested by New South Wales Health older persons to come and present to them our health prompt. There were several projects identified at that particular forum that would be piloted across New South Wales and involving a number of LHDs. And one such project was that of the Neami Physical Health Prompt, which is a screening tool to promote conversation in the community, in community practice using a recovery approach. So this led to the co-design of an actual older person's physical health prompt, and that we would hope we would pilot it with 5 LHDs across New South Wales. So this project is actually still ongoing, which is great. And for those of you who haven't seen the Neami Physical Health Prompt, this is what it looked like in the very beginning. It was composed of 28 questions. It was a generic version. It was a strength-based questions to really hold conversations around physical health for people. So this is the generic version that we brought to the table. So in line with Neami's in our consumer participation framework, we sent out an EOI, so an expression of interest across all of our services to ask older persons that avail of Neami services, so those consumers who identified over the age of 60, if they would be interested in coming and if they showed an interest in really looking at co-design and physical health promotion. Part of this process of what we did is we actually scope health services and what exists among health services in relation to prompts or questionnaires around physical health, or that supports the physical health of people. And one such one was this particular one, which is the Healthy Aging Quiz. And what we identified from this is, yes, while it is worth what it's worth, it is very much a questionnaire and quite clinical, and it really doesn't explore having conversations with people. So the older people that we sent out this information to, we gave them some pre-reading to show them what existed, came back and they found that this resources was not empowering to them, and it didn't make them want to take ownership of their own physical health. So there was and it didn't really give an opportunity for conversation around their physical health. There were several others that we did send out to make sure that people had some background knowledge as to what was being done currently in New South Wales around older persons' physical health. So with the co-design process continued, we had one online, we moved to one online due to the COVID focus group. And then after that, we were lucky enough to be able to move on and have 3 more face-to-face. So consumers came from across Neami services and we all met in a particular venue to start the process of that co-design and the co-designing of an older person's health prompt. So I'll hand you over to Whitney.
Thank you. Okay, so just looking at some of the co-design feedback that we got from the focus groups, the first thing was to look at national recommendations, pretend that isn't formatted wrong. So we needed to clarify the national recommendations for this age group. The The original health prompt that we had wasn't for age 65 and plus. It was a generic health prompt. So we had to have a discussion about what questions should be on there and what should the national recommendations be. We had a big discussion about the language, so whether we use older persons versus seniors. We also had a discussion around the age group, so what is classified, what age group we are trying to capture within this. So we decided with 60 plus. And then we also had to have a discussion about the language around using older persons and seniors. Some people were like, I don't want to be known as old, like I don't want to be old person, and then other people didn't like the word seniors. So we did go with the older person's health prompt at this stage, but we are in the pilot. We already have gotten some feedback that some people don't identify as old. So we probably will change the language to physical health prompt 60 years plus, so that it's a tangible age number, not so much that judgment around the language around olders versus seniors. We had a lot of discussion about accessibility. So accessibility of healthcare. So things like costs, transport, affording transport to get to healthcare appointments, talking about how GPs can be so busy, and so someone can be sick, and then by the time they can even go and see their GP 2 or 3 weeks later, then they're no longer sick anymore, and then they're going to a GP appointment for no reason. And then we also talked about specialists. So by the time we're reaching this age group, there are a lot of specialist appointments, and these are so expensive. So people aren't able to afford specialist appointments. They can't afford the fees. People can't cancel and don't get that healthcare because they can't afford it. We talked about physical activity, and we really needed to unpack this because one of the questions is, according to the national guidelines, do you do 5 days or more of moderate physical activity? And we had to unpack, what does that look like? What does moderate activity look like for the ages 60 plus? What kind of activities? Is that the right guideline for that age group? And we also needed some clarity about what is moderate physical activity. What does that look like? And we also decided to add some more questions about resistance training and strength training and muscle resistance, which is really relevant for this age group as well. But it was found that we really need to ask this question, and it was an important question to keep in the health prompt. There was a question around wording, ironically, how that word is. So we had a discussion around wording. One of the questions we ask is, can you hear and understand things easily? And for this age group, they actually found that to be a little bit offensive. So they were saying, what do you mean, do I understand things? Do you think I'm stupid? So we actually had to change that question and look at the wording and how that's going to be perceived by this age group. We looked at nutrition, so we had a lot of discussion around nutrition for this age group. So looking at if that person had no transport, how can they access the food? Being able to carry the food back from the grocery shops to home, it can be really heavy and it can be really painful for the person. We talked about buying lots of fresh food, but it going off before they can even eat it. Cooking big portions, but then not being able to portion control. So eating it all instead of saving it. But also cooking for themselves as a single person and having to cook a lot, or kind of not being bothered to cook if it's just for them. Some people didn't have control over their nutrition, so if they're living in a nursing home. So we did, in the pilot, we're implementing this in mental health units and in nursing homes, and as well as in the community. So some people have control over their meals and other people have less control. We talked about people using microwave meals, and even though there can be nutrition with those, we talked about the sodium content. And then so again, and we talked about people living alone and not being bothered to cook for themselves. So we unpacked falls and balancing quite a fair bit in the co-design focus groups. So in the original health prompt, there's only one question about it, but we actually found that we needed to unpack this a lot more and also include things about being able to navigate through small areas, and being able to keep their balance and how to maintain their balance without falling. Oops. So we talked about medication, and there was a lot of discussion about doctors not explaining medication well, not being told about side effects and having choice around their own health and being able to control side effects, not being told about drug-on-drug interactions. So a lot of the people we talked to were a lot of medications, not just for mental health medications, but chronic physical health medications, and not being told about the interaction of the different drug-on-drug, and also not being told about the long-term efficacy of the drugs they're on. So maybe kind of that assumption, because they're in that older age group, we don't need to talk about the long-term kind of efficacy, but that was a really important conversation to have that the consumers spoke about in the focus groups. And sexual, oh gosh, that's terrible formatting there, sorry guys. So we also talked about sexual health, and there can be a lot of stigma and a lot of fear around talking about sexual health, but we actually found through the focus groups that consumers want to be asked this. They said, we want to keep this in here and we want to talk about, we have a right to be asked about this. And then we unpacked it a little bit more, because sexual health isn't just about STIs and using contraception, but it's about intimacy, it's about relationships. And we didn't really get that from the health prompts that we had originally. That wasn't the messaging that consumers were getting. So we actually added an additional question to ask about their relationship and intimacy. We also talked about vaccinations. So this vaccinations isn't a question in the original physical health prompt, and it was found that we really need to talk about this for this age group, that it's really important that that person does keep up to date with their vaccinations and they do have that conversation. And then a really big topic was also about pain. So there was a lot of discussion about pain, needing to talk about it, needing to explore what's going on for that person. So we actually added questions about pain and added it into the body chart. So this is the comparison between what we did from the original health prompt and the older person's health prompt. So some of the obvious things are, we changed the colour. They said that the orange kind of faded and it was really hard to see. We also made the font a lot bigger. We changed the introduction, so the consumers actually changed the wording of this and changed the language to be something that they identified a little bit more with. So we added some questions. So we talked about cardiovascular disease, vaccinations. We included muscle strengthening exercises to the physical activity question. Have you had conversations regarding your kidney health, and happy with your current relationship or intimacy? Then these are some of the questions we unpacked to split it up. So the first question is, are you able to keep your balance and have not fallen recently? So we had to actually unpack that a little bit more. So we unpacked it into 3 questions, because again, this was really important for this age group. And then we also changed the question, the sexual health question. No, we changed the bowel function question to, have you had healthy bladder function, and do you feel you have healthy bowel function? So we split that up where it was originally 1 question. We also looked at the body chart, so we included the language around experiencing pain or discomfort, and we also added a back picture to the image, not just the front. So this is where the participant can come in and circle where they're experiencing pain and write any comments. So another thing that we did for this project is we also put together an instructional video. So I'm going to play
What
it.
should you keep in mind around best practice in physical health prompt delivery?
Be mindful of your own discomfort over some questions and remain non-judgmental. For example, question 32, are you happy with your current relationship or intimacy? Everyone has a right to intimacy, and it is an important question to ask. Consider that this may be the first time the individual has been asked this question, and may actually like the opportunity to speak about it. Perhaps explore for yourself why your discomfort has occurred. Take into account each individual's own unique set of circumstances, backgrounds, and values. So be aware of cultural differences, LGBTIQ+, culturally and linguistically diverse, homelessness, religion, Aboriginal or Torres Strait Islander, or other factors.
So this video we put together to support staff, mental health staff, to be able to have the conversations and to be able to use the health prompts. So again, it's not supposed to be some screening tool, it's supposed to be a conversation tool. So being able to have conversations with the consumers about the different physical health topics, not just kind of ticking the boxes. So that was the purpose of the video. We also looked at data collection and monitoring. So we put together a survey monkey to include being able to capture all the information that we need to for the pilot project. And so we collected yes, no, and NA responses, as well as some comments. And so we've currently received completed health prompts from 3 of the 5 LHDs that this is being piloted in, and we've just onboarded 2 more LHDs into the SurveyMonkey. So we're just going to have a look at a few of the responses. So these are the top no responses. So these are the percentages for these questions that people have responded no to. So that means they have not been asked this and they haven't addressed this with their health professionals. So things like, 52% have not, say that they don't do muscle strengthening exercises 2 to 3 times per week. 48% said have not had a conversation with their GP about risk of cardiovascular disease. And so with cardiovascular disease, coronary heart disease is the first or the second leading cause of death for the age groups of 65 to 85 plus. And 48% of people have not addressed this with a health professional. The 4th highest cause of death is colorectal cancer in the age group of 65 to 74, and 65% of people haven't spoken about bowel cancer. And then we talk about hearing tests. We know if people have hearing issues, that how isolating that can be for people, and 65% of people haven't had that addressed or talked to. So these are just some of the higher no responses, but it really shows that these conversations need to be happening because it's showing up on our health prompt results. These are some of the comments that came back in the results. So there was a lot of talk about pain. There was 7 comments about pain for that person, for different people. So it really shows that that question about pain really needs to be in the health prompt. This is also really concerning. So one person wrote back that diabetes is affecting eyesight and ability to accurately read insulin pens. Home care staff are unable to check or change if incorrect. That person is being put at risk with their physical health because of their eyesight. They're not getting basic health care around managing their diabetes, and that is putting them at high risk. And so who's having this conversation? And that is why we need to be doing the health prompt and having physical health conversations, because has this been addressed? And our health prompt has captured this. So these are some other concerns that did come up in the comments. So there were a lot of comments about falls and mobility. Someone spoke about being really hard of hearing. There were weight concerns. And this was actually interesting because it's not just, the question is, are you comfortable with your weight? So there's someone who is looking at addressing their weight and has lost 5 kilos. But another person actually spoke about they experience a lot of weight loss and they don't know what's going on. So they're actually exploring that with their GP. So looking at incontinence, mood, respiratory issues. So lung cancer is the leading cause of death in age 65 to 75, and the fourth leading cause of death in age 75 to 84. So another one that's really important to be asking about. That person actually is experiencing lung cancer, has never smoked in their life as well. Sleep conversations and medication as well.
Okay, so just to sum up there, so this again is an ongoing pilot project with the health prompt, the older persons. We will be getting it back and reviewing it. As I said, we're working alongside New South Wales older persons mental health. But look, some of the things I've been in direct contact with the LHDs myself, and talking to some of the the nurses or the community mental health services or the managers of the care facilities. And some of the conversations I've had have really concerned me in regards to their acceptance of such a form or such a tool to have conversations. And some of the things were staff comfort around asking the questions. A staff member said to me, literally on Skype or on Zoom, well, I'm not asking that question of an older person. That's embarrassing. And I said, well, maybe that's your assumption. You're the one that's uncomfortable with that. Have you actually asked the person? So that they're quite concerning. The other one was that I got back was, well, actually, what am I going to say to my staff? Because they're not up to date with all of their medical education. So they mightn't ask those questions around cholesterol and diabetes, just in case somebody asks them a question about it and they don't have the answer. And I said, well, look, it's not about the answer. It's about having the conversation and finding out. I said, we're not, well, maybe, yeah, they should have information about it, but this has been offered in the community by community mental health people, and we're saving lives. We've had consumers in community mental health services in Neami that have had their prostate checked directly because of the health prompt identified that it was cancerous, and it saved their lives. So let's do this, as you can see from the percentages. So we need to get rid of these assumptions around sensitive topics. We need to get recovery conversations into the clinical practice and change their way of talking to consumers. Thank you very much. I dropped loads.
Thank you, Vicki and Whitney. We have time for one very quick question. Otherwise, I'm sure people will be happy to talk to Caroline.
Yeah, I've got a quick question. I'm just interested, a lot of these patients would also be eligible for a chronic disease management plan, or some of them over 75 health assessment from their GP. Did you get any data about how many people have had both types of assessments and whether they're correlated? Because my concern is not asking the questions, but maybe the tool isn't helpful. They're giving the information, but we're not acting on it in a number of platforms.
Right. So at the moment, that's what we're trying to identify, if there's anything been done about this. And this is what some of the responses that we've had is, well, what are we supposed to do about it? That means we're going to have more work to be able to address all of these questions. And we're like, well, when the GP comes around to visit, or the clinicians come around to visit, use this as something that needs to be done, or these particular ones need to be addressed, or these physical health. From what I can tell, there is no correlation between our connection between the two right now. And I said I'm working with John from the ministry, and they're actually presenting next door about this, and that's why this particular project, because it's about service improvement for older persons living with mental illness. So that's what we're trying to attack. Yeah, thank you.